Hello everyone, I'm Dr. Anisha Rajan. I completed my master's in orthodontics and dentofacial orthopedics from Government Dental College and Hospital, Mumbai. Currently, I am serving as an assistant professor in GDC Mumbai. So, today we will read about contemporary orthodontic appliances. So, this is a very important topic with if you consider it for university examination as well as your MCQ part. So, in case of your competitive MCQ questions, it can come as a diagram based questions also. So, we will read what are the important topics that you need to focus when it comes to your removable appliances as well as your fixed appliances. Okay, so let's learn. So first we will read about removable orthodontic appliances. So what are removable appliances? These are the appliances which can be removed by the patient. Okay, so what will be the biggest disadvantage when you consider the removable appliances? So biggest disadvantage of removable appliances is as it depends upon the compliance of the patient. So it will be difficult to get results in uncooperative patients. Okay, it is capable of only tipping kind of movement when compared to fixed appliances which are capable of your bodily kind of movement also. So these removable appliances only are used for minor tooth movements. It can be removed by the patient for cleaning purpose. Also, if it is paining for the patient can easily remove the appliance. It is less conspicuous when compared to your fixed orthodontic appliances as less chair side time. So what does this mean? Uh, the chair side time with patients when we are giving the removable appliances is lesser when we compare it with the fixed appliances because these appliances can be manufactured in the laboratory. So the chair side time becomes lesser when compared to the fixed appliances. Okay. So what will be the disadvantages? Because biggest disadvantage is the cooperation of the patients. Also, multiple tooth movements and complex tooth movements are not possible with removable appliances. So it is capable of only treating the simple malocclusion. Okay. Next, what are the components of removable appliances? So removable appliances, the components are retentive components, the base plate, the active components. So these are the different components of removable appliances. So first we will see what are the retentive components. So what is the meaning of the word retention? Retention means um, it is a means by which displacement of appliance is resisted. Okay, so it is a means by which the appliance will not dislodge from the oral cavity. So these are the retentive components. What are the examples of retentive components? All your clasps. All the clasps come under your retentive components. Okay. So we will see various types of clasp which are used for retention. Just identify which are the clasps and what are the diagrams associated with that. Okay, because sometimes they can ask this as a diagrammatic question. Okay, so circumferential clasp, it is also known as C clasp. Okay, it is used to engage the buccocervical undercut. Okay, so circumferential clasp, this can be used as a retentive component. Okay. Next is the Jackson's clasp. Any guesses for what is the other name of Jackson's clasp? Yes, it is also known as your U clasp or full clasp. Okay, so it is used to engage both the buccocervical undercut. It is also used for retention purpose. So this is the Jackson's clasp or the U clasp. Next is a triangular clasp. So this is a diagrammatic representation. So here we can see this is a triangular clasp. Okay, so it is used for retention for the posterior teeth. Okay, this is the triangular clasp. Next, very important clasp which is often asked in your university examinations as well as your MCQ questions also. What is an AIIMS clasp? So first we will see what are the other names of this AIIMS clasp. So it is also known as Liverpool clasp, universal clasp, or modified arrowhead clasp. Okay, so these are the other names of AIIMS clasp. So just remember these names. Okay, so this is the AIIMS clasp. So we will see what are the parts of AIIMS clasp. Okay, first, okay, so first is your bridge. So this is your bridge. Okay, these are your arrowheads. Okay, and this is your retentive arm. So these are the different parts of the AIIMS clasp. So what are the advantages of AIIMS clasp? It is small, neat, occupies minimum space. Okay, it provides an excellent retention. Important thing is it can be used on any tooth. Okay, it can be used on any tooth. So first we will see what are the other modifications of this AIIMS clasp. So this is an AIIMS clasp with single arrow head. Okay, this is a AIIMS clasp with J hook. So what is the purpose of this J hook? So you can see this J hook. Okay, so what is the purpose of J hook? To engage the elastics. Okay, so this is a AIIMS with additional arrowhead. So this is used when more amount of retention is required. So these are the various modifications of AIIMS clasp. Some more modifications. So this is a AIIMS clasp with distal extension. Okay, so you can see this. This is a AIIMS clasp with distal extension. This is AIIMS clasp which is given on the maxillary central incisors. So these are the different modifications of AIIMS clasp. Just remember the diagrams, the different names of the AIIMS clasp and the parts of the AIIMS clasp. Okay. Okay, next one more clasp that you have to read about is the delta clasp. So this was introduced by William J. Clark. Okay, this is similar to your AIIMS clasp. Okay, so you can see it is similar to your AIIMS clasp, but there is a triangular shape. So this is a delta triangular shaped arrowhead. So this is a delta clasp. So this was introduced by William J. Clark. Mainly it is used for your twin block appliance. So what is a twin block appliance? It is a myofunctional appliance. Okay, so it is a myofunctional appliance. Next, coming to base plate. So base plate, it is a greatest portion of removable appliance. Okay, So the main purpose of base plate is it act as a vehicle to carry all other parts of the appliance. Okay, so it is a part where all other clasps and the active components are attached. So it acts as a vehicle. Also, it serves as an anchorage source. Okay, so this is a base plate. Next, coming to the active components. So till now we studied about the retentive components, which are the clasp, the base plate. Now we will see about the active components of the removable appliances. So the active components are bows, strings, elastics, and screws. So these are the active components of removable appliances. First, coming to the labial bow. Okay, so this is a labial bow. Just remember this diagram. So these are used, so U-loop. So this is a U-loop type of labial bow, which is used to reduce the minor overjet. Okay, where the spaces, interdental spaces, are present mesial to canine. So this is a short labial bow, also known as short labial bow. Okay, so how will you activate this? We will activate it by compressing this U-loop. This is a U-loop. So with plier you will, so you can see this, with plier you will compress the U-loop and activate the labial bow. Okay. Next, coming to long labial bow. So it is similar to your short labial bow, but it is extending up to your first premolar. So what is the indication? When there is interdental spaces distal to canine. So if there are interdental spaces distal to the canine also, you will use the long labial bow. Okay. Now, so this is a Mills bow or extended labial bow. So you can see the amount of wire incorporated in this. There is extensive amount of wire incorporated. So we are increasing the length of the wire. Okay, so what will happen if we increase the length of the wire? It will increase the flexibility. Okay, so this is a Mills labial bow or extended labial bow. Again, the purpose is, so this can be used to reduce large overjets. Okay, so this is a Mills bow or extended labial bow. Next, coming to high labial bow with apron springs. So this is a high labial bow with apron springs. So this is a heavy stainless steel wire. On that light round wire is placed. So this is an apron spring. Okay, this is also used in cases of overjets to reduce the major amount of overjet. So again, you are increasing the length of the wire, which will increase the flexibility of the appliance. Okay, so remember this diagram, high labial bow with apron spring. Next, this is a Roberts retractor. So you can see Roberts retractor with, you can see a helix incorporated in this Roberts retractor. Okay, so what will be the purpose of the Roberts retractor? It will, okay, so the Roberts retractor, it has helix in it, so it will increase the length of the wire. Again, it will increase the flexibility. Next, coming to your fitted labial bow. So this is a fitted labial. As you can see, it is completely encircling or fitting the labial surface of the tooth. So what is the purpose of this fitted labial bow? It is mainly used for retention, while all other labial bows till now we studied are used for retraction or closure of overjet of spaces. Overjet, or it is used for correction of overjets or used to close the spaces, while the fitted labial bow is used as a retention appliance. Okay. Next, coming to the springs. So what are the springs? Springs are the active components of the removable appliances. Now we will see what is the effect of diameter and effect of length. What is the relation between the length force and the diameter of the wire? So force is directly proportional to d4 by L cube. Okay, so this is a formula that you should remember. So force is directly proportional to your diameter. What does this mean? If you are increasing the diameter of a wire, it will increase the force. But if you are increasing the length of the wire, it will decrease the force. So till now I have told you about the modifications in different labial bows, right? Like in Mills labial bow, in Roberts retractor. What are they doing? In Roberts retractor, they were incorporating helix. In Mills retractor, they are increasing the length of the wire. So why are they doing this? So this increasing the length of the wire will decrease your force. So this is the purpose. Reduce the force applied to the dentition. We are increasing the length of the wire. Okay. Okay. So coming to the classification of the springs. So springs are classified based on your direction of tooth movement. Okay, based on direction of tooth movement, it can be used for mesodistal movement, labiolingual movement. Okay, next, springs can be used for based on the nature of support. Okay, so based on the nature of support, it can be okay based on the nature of support, it can be self-supported springs, or it can be guided springs. Okay, so these are the various classification of springs. Also that can be with helix or it can be without helix. Okay. Okay, now we will see various springs. So first is a single cantilever spring, also known as your finger spring. Okay, so this is a finger spring. You can see the parts. So this is the active part which is encircling the tooth. Okay, this is a coil and this is a retentive arm. So this is a finger spring. So what is the purpose of the finger spring? It is used for mesodistal movement of the teeth. So it can be used to close the midline diastema. Okay, just remember this diagram. So this is also known as single cantilever spring. Now coming to double cantilever spring. This is also known as Z spring. Okay, so you can see this. Okay, so these are the two helices are incorporated in the Z spring. Okay, so these are inserted perpendicular to the palatal surface of the teeth. Okay, it is indicated when you need the buccal or labial movement of incisors. So it is used for your labiolingual correction. Okay, activation, how will you activate it? By opening the coils. Okay, so I mentioned something about the perpendicular to palatal surface. So if you're not placing this Z spring perpendicular to your palatal surface, what will happen? It will tend to intrude the teeth. So that is why it is advised that whenever you are placing the Z spring, it should be placed perpendicular to the palatal surface of the tooth. Next, coming to the T spring. Okay, so these are the T spring. Okay, so this is used for your buccal movement of premolars and molars. So this is a T-spring. Next, coming to the coffin spring. So this was introduced by Walter Coffin. Okay, so this is a coffin spring which is a omega shaped. Omega shaped. Okay, so what is the use of this coffin spring? It is used for your slow dentoalveolar expansion. It is used for your expansion. Okay, you incorporate this coffin spring, you split the acrylic in between. Okay, you will split the acrylic and you will activate it. Okay, so this is a coffin spring which are used for your expansion. So these are the different springs. So springs are the active components of the removable appliances. Okay, next coming to your retractors. So the classification of retractor. So based on the location, it can be buccal canine retractor or palatal canine retractor. Based on presence of helix or loop, it can be helical canine retractor or it can be a canine retractor with a loop. Okay, also another classification is based on mode of action. So it can be push type or it can be pull type. So these are the various classification of your canine retractors. Okay, coming to self-supported, buccal self-supported canine retractors. So there are two types as mentioned. There is self-supported and there is supported canine retractor. So what will be the difference? Self-supported, as the name indicates, it is capable of supporting itself. Okay, so how is this possible? By making this canine retractor with a thicker gauge wire. So if you are making the canine retractor with a thicker gauge, it is able to support itself. So this is a buccal self-supported canine retractor. Next is the supported canine retractor. So it is similar to the design is similar to your self-supported canine retractor. What will be the difference? This will be made up of your thinner gauge wire. So if it is made up of thinner gauge wire, it is not capable of supporting itself. So how will you give support? It is supported by giving a stainless steel tubing to the wire. So as you can see here, we can give a stainless steel tubing to the wire. Okay, this is a supported buccal canine retractor. Next, coming to reverse loop canine retractor. So this is a reverse loop canine retractor. Okay, this can be used in case of shallow sulcus. Okay, how will you activate it? Activation is by cutting this free end, okay, from the free end and then readapting it. Okay, so this is a reverse loop canine retractor. Just remember the diagrams. Okay, next coming to your U-loop buccal canine retractor. So this is a U-loop canine retractor. Okay, so it is U-loop canine retractor. It is used for retraction of canine. So this was your U-loop canine retractor, which is simple in design, which is used for retraction of the canine. Okay, next coming to the palatal canine retractor. As you can see, this canine retractor is placed palatally. So this is used when the canines are placed in the palatal direction. So to retract the canines which are placed in palatal direction, we use this palatal canine retractor. Next, coming to another active components which are screws. So these are the expansion screws which you can see. It is used to move individual teeth or group of teeth. Okay, so types of screws, it can be used for maxillary expansion, can be used for mandibular expansion. Okay, it can be used for bilateral expansion, sectional expansion. So you can see this. This is a sectional expansion where you are incorporating the expansion screws in this region. It will move this segment distally. Okay, so this is a sectional type of expansion. So if you are in splitting the acrylic here also, so this is a expansion in three direction where you will do expansion in this direction, in this, and in this direction. So these are the different types of screws which are used for different expansion. Okay, what are the instructions which are to be given to the patients whenever the patient is using the removable appliances? He should be very compliant, because if the patient is not compliant and if patient is not wearing the appliance, there is no use of this removable appliance. So you should give proper instructions to patients whenever you are giving the removable appliances. So what are the instructions to be given? That there will be initial discomfort. Okay, so if there is minor discomfort, it will be there for almost 1 week, which if the patient is facing too much of discomfort, then patient can report immediately. Okay, you should train the patient according to this. Also, you should tell them that it can interfere with their phonetics. Okay, so initially there will be discomfort and it will disturb their speech, which will be corrected after some time. Okay, then whatever new appliance you are using in your mouth, there will be increased salivation. So there will be increased salivation. You should instruct that to the patient, and you should instruct the patient that the appliance should be cleaned after having food. Okay, always after you are having food, the appliance should be cleaned properly. Okay, and it should be worn full time except while patient is brushing or having food. And while patient is not wearing the appliance, it should not be kept as such in the air. It should be kept in a normal temperature water or cold water in a bowl. It should not be left dry in the dry air, because this can lead to distortion of the appliance and appliance will not fit properly. So you should instruct the patients whenever you are giving this removable appliances. So this completes our removable appliances part. Okay, next we will read about fixed orthodontic appliances. Okay, so we will just cover what are the important topics that you should remember in fixed appliances. Okay, so first of all, what are the components of fixed appliances? So it is divided into active components and passive components. So what are the active components of fixed appliances? These are the arch wires, springs, elastics, separators. So these are the active components of your fixed appliances. What are the passive components? These are the brackets, molar tubes, bands. Okay, we will see them in detail. What are these components? Okay, so bands. So these bands are made up of stainless steel. These are available in different sizes. Okay, so this can be either preformed like this. Okay, preformed bands are available, or it can be custom made according to the size of the tooth of the patient. Okay, these can be either preformed or it can be custom made. Okay, these bands are smooth on outer surface and rough on the inner surface. Okay, so these are the bands which can be used on your molar teeth. Okay, next are the molar tubes. Okay, so there are different types of molar tubes. This is a single tube molar tube. So you can see here two slots, which is the double tubes, and you can see here three slots. These are the triple molar tube. So what is the function of this? So this is the main arch wire slot where you engage your main arch wire. So why is this extra one given? It is used. It is also known as your headgear tube. So whenever you are giving headgear to the patient, the inner bow of the headgear will go into this tube. Okay, so this is also known as the headgear tube. Also, these molar tubes can be either bondable or it can be weldable. So these are weldable molar tubes. You can see the base. The base is plain. It is just welded onto the bands. While this is the bondable molar tubes. In the bondable molar tubes, you can see these meshes. So these are used for retention, mechanical retention onto the tooth surface. So these are the molar tubes. Just remember these diagrams. Okay. Next, coming to brackets. So there are various classification of brackets. Okay. So based on the slot design, it can be a horizontal bracket or it can be a vertical bracket. Okay. So you can see why I'm calling this as horizontal slot. So you can see this is a horizontal slot and archware will pass like this. Okay. And here in this slot you can see it is a vertical slot. Okay. So these are the classification of brackets based on the different slot designs. Next, coming to the classification of brackets based on material. So various materials are used. So these are the stainless steel material and these are the ceramic brackets. So in patients who are very concerned about their aesthetics, who do not want any metal look in the mouth, so you can give them ceramic brackets. So these are the ceramic brackets. These are the plastic brackets. Okay. Next, coming to the method of ligation. So either it can be self-ligating or non-self-ligating. What does this mean? Okay, as you can see in this diagram, this is a bracket and this is your arch wire. You are engaging this arch wire around the bracket with the help of a elastomeric, this rubber material. So these are you are using this material to tie the arch wire onto the bracket slot. So these are the non-self-ligating brackets. Well, what is self-ligating brackets? So you can see here this arch wire is passing through this bracket slot and you are not using any elastomeric material to tie the arch wire to the slot. Here, this is a fourth wall, okay, which which closes by itself, okay, which closes when you push this part, it will close and it will engage this arch wire. So these are the self-ligating brackets. Next, the classification is based on mode of attachment. Either the brackets can be weldable or it can be bondable. So again, weldable means there will be plain surface without any mesh which are welded onto the bands. Okay. And bondable brackets, it will have mesh which are used to for the bonding onto the tooth surface and it is bonded with the help of a mechanical retention. Next, coming to the ligature wires and lock pins. Okay, so what are the ligature wires? So as you can see, this is a bracket, okay, and this is a arch wire. So remember I told an elastomeric material is used to tie the arch wire around the bracket. Instead of this elastomeric material, you can use the ligature wire. So this stainless steel ligature wire can be used for engaging the arch wire onto the bracket. Okay, so this is a ligature wire and this is lock pins. These are also used to secure your arch wire around the bracket. Okay, so these are mainly used in your Beck's technique. Okay, just remember lock pins are used in your Beck's technique. These were the passive components of the fixed appliances: brackets, bands, ligature wires, and the lock pins. Now coming to the active components, so what is the difference? Active components are able to apply the force. Okay, so coming to the separators. So separator, these are used to create space between the dentition. So when it is required, whenever you are doing banding of the teeth, you will require space in mesially and distally to the tooth. Okay, for that to create space between the tooth, we will use the separators. So this can be your elastic separators or it can be your Kessling separator. So elastic separators are this blue colored, you can see. These are made up of a rubber material. Okay, so it will swell and it will create the space. Okay, and these are the Kessling separator. Okay, so these are made up of your stainless steel wire. Just remember the diagram. This is the elastic separator and this is the Kessling type of separator. Next, coming to your arch wires. So various materials used in arch wires are, these are the stainless steel arch wires. You can see this white colored arch wire. These are the ceramic coated arch wires. This is the nickel titanium arch wire, which is used for your initial leveling and alignment stage. Okay, now what are the ideal properties that an arch wire should possess? It should have a large spring back action. What is the meaning of large spring back? It should be able to come to its original size whenever the force is removed. So it should have large spring back. It should have low stiffness. Okay, low stiffness means it should have high flexibility. It should not be stiff. Okay, um, it should have high formability. It should have low surface friction. Okay, what is this low surface friction means? If a wire is having friction, it will not be able to move the tape properly. So it should have low surface friction. It should be biocompatible to the tissues and it should be cheap. So these are the ideal properties of the arch wires. Okay. Next, coming to another active components of fixed appliance, which are the springs. So these are the springs. You can see open coil springs. So you can see this. You have kept spring between these two tooth, which will open up the space between these two tooth. So this is known as the open coil spring. Next is the closed coil spring. You can see here you have placed the spring. So why closed coil spring is used? As the name suggests, it is used for closing up of spaces. So you have extracted one premolar here. You are closing this space. So you are using the closed coil spring. Okay, this is a uprighting spring. So these are used to upright the tooth. It is mainly used in your Beck's technique. Okay, so these are the different springs. Remember the diagrams. Okay. Next, coming to the elastomeric material. So elastomerics are classified as either it can be worn intraoral or it can be extraoral. There can be elastomeric chains, threads, or modules. We'll see. Okay, so these are the inter-arch elastics. So what is inter-arch means? It is between the two arches. So you can see class 2 elastic, which is given from the maxillary canine to your mandibular molar. So this is your class 2 elastics. Class 3 elastics, which is given from the mandibular canine to your maxillary molar. And these are the diagonal elastic. Okay. So diagonal elastics are used for your midline correction. Remember these diagrams. Okay, so they can ask you this as a diagram based question. They can ask you what is this type of elastic. Okay, so these are the diagonal elastics. This can be used for your midline correction. Next, other examples of interarch elastics are the crossbite elastics. So whenever there is crossbite present, you can engage the elastic from the buccal aspect of mandibular posteriors to the lingual aspect of the maxillary posteriors. Okay, to correct the crossbite. Another type of interarch elastics are the box elastics. These are used for open bite cases. Okay, it will close the bite. So these are the different kind of interarch elastics. Next, these are the extraoral elastic. You can see this is a face bow, which is an orthopedic appliance, which is used to protract the maxilla. So you can see some elastic kind of thing. Okay, so this is an extraoral elastic, which can be used with your headgear or with your face mask. Next, coming to your elastomeric chains. So these are your elastomeric chain, also known as E-chain. So this can be used for closure of spaces. Okay. Another thing is this elastomeric modules, which is used to tie the arch wire around the bracket slot. These are used the elastic thread. Okay, just remember diagrams. Okay. Next, coming to the procedure in fixed mechanotherapy. Simple, just remember first step you will do is banding, then you will do bonding, and then debonding. So from banding, first you will place the separator. So first process is a separator application, then band selection for according to the size of the tooth, then you will isolate, and then you will cement the band. Okay, so these are the various steps involved in your banding. Next, coming to your bonding. Bonding can be divided into your direct bonding or indirect bonding. Direct bonding means you are directly bonding the attachment to the patient's dentition. Indirect bonding, you are attaching the brackets onto the cast, and then these brackets are indirectly transferred onto the patient's mouth. Okay, so these are the different types of bonding techniques. First is direct bonding and one is indirect bonding. Okay, so in direct bonding, it is easier, faster when compared to your indirect bonding, while indirect bonding require less chair side time. Okay, so this is a direct bonding where you will first clean the tooth. Okay, then you will do etching of the tooth with 37% phosphoric acid. Then you will place the bonding agent and compose it over the bracket, and then you will place the bracket according to the proper positioning of the brackets, and then you will finally cure. Okay, so these are the steps in the direct bonding. Next, coming to the indirect bonding, you can see the brackets are placed onto the tooth surface. Then you take the impression of this entire bracket. Okay, so you will take this with the help of an elastomeric impression material. Okay, so you will take the impression and these brackets get transferred onto these impressions. Then you will prepare the tooth surface. You will etch and apply the primer. Okay, and apply the bonding agent, and then you will place like this. The tray is placed onto the dentition, and then you will cure. Whenever you are curing, after that you will remove the trays in section. You will remove the trays in section. So you can, this is a, the bracket get transferred onto the dentition. Okay, so this is a indirect bonding. Don't go into detail regarding this. Just remember there is two types of bonding, that is direct and indirect bonding. In direct bonding, you are bonding the brackets directly onto the patient's dentition, while in indirect bonding, you are bonding the brackets onto the cast first. Okay. Coming to debonding. Debonding is a final procedure after completion of your orthodontic treatment. You will remove the brackets and the residual composite is removed after that. Okay. Next, some things about this bends: first order, second order, and third order bends. So first order bends, these are known as labiolingual bends. So these are given in labiolingual direction to move the tooth in the labiolingual direction. So these are the first order bends. This is the second order bends, also known as artistic bends. They are the artistic bends which are given in mesiodistal correction. Next is the third order bend, which is a torque bend, which is used to correct the root inclination. Just remember what are the first order, second order, and third order bends. Okay. Next, sometimes they can ask you about this Beck's bracket. Okay, Beck's technique. So remember some important points regarding this. This is also known as your modified ribbon arch method. Okay, it will cause the tipping of teeth. It uses AJ Wilcock wire Okay, so this is a AJ Wilcock wire, which is a heat treated and cold drawn wire. It uses differential force method and it is divided into 3 stages. So these are some points that you should remember about the Beck's technique. Okay, it uses this AJ Wilcock wire, which is a heat treated and cold drawn wire. This is a Beck's bracket. Okay, it uses differential force and it has 3 stages. Okay, stage 1, 2, and 3. Coming to your lingual technique, just remember it was given by Craven, Curse. Okay, so these are given in patients who have high aesthetic demands. Oh, so these are given onto your palatal or lingual surfaces of the teeth. So this uses mushroom shaped arch wire. Just remember, mushroom shaped arch wires are used in lingual technique. Okay, so this completes our fixed orthodontic appliances topic also. I hope it is clear for you guys. Let's read uh, 2 3 questions regarding this topic. Okay, so differential force concept, it is mainly used in, as mentioned, it is used with the Beck's light wire appliance. So see, this is what I mentioned. They can sometimes ask you these kind of questions. So just remember the important points when it comes to your Beck's appliance. Okay. Next, rotation of teeth is best corrected by. So, as you know, the complex tooth movements, all the complex tooth movements are best corrected by your fixed appliance. Okay. For setting of the teeth in final occlusion at the end of your fixed orthodontic therapy, we use this inter-arch elastic. So you can see this elastics. So these are used, these elastics can also be used for settling of the teeth. After the completion of your orthodontic treatment, you will use for final occlusion or settling of the teeth properly. Okay. Intermaxillary elastics are used for the correction. Intermaxillary means between 2 arches. So it can be used for your class 2 as well as class 3. So option is B and C. So I hope you all are clear with your removable appliances and fixed appliances topic. Okay, if there is any doubt, you can uh, ask or post questions. Okay, so happy studying. Okay, have a nice day, everyone. Bye.